Some common problems associated with children's teeth include cavities. There's one shown here. Small cavities in either a baby tooth or a permanent tooth could be repaired with a filling, but more extensive cavities would require removing a little bit of the top of the tooth to create enough space to put a cap on top. If a tooth is severely damaged and the dentist thinks that a filling will not hold, then a cap, which is also called a crown, would be the restoration of choice, because a crown or a cap fits over like a little hat on top of the tooth, and it holds the remaining part of the tooth together. When a child loses a baby tooth prematurely, so say this one were lost before it was time for it to be replaced by the underlying tooth, the teeth behind would shift forward and crowd into this space. When the permanent tooth down here finally begins to erupt, it might not have enough room. See, if this tooth is bent over like this into the space where the baby tooth was, then this tooth is not going to be able to erupt straight. It could remain in the bone, in which case it would be called an impacted tooth, or it could erupt either too far forward or too far back. It could overlap with other teeth. In short, the bite would not be as it should be if the tooth does not come in straight. If a baby tooth is lost prematurely, the dentist will often recommend that a space maintainer be placed in the child's mouth to hold the opening for future use by the permanent tooth. A space maintainer would attach to teeth in front and teeth behind and maintain the opening. That way, when the permanent tooth begins to erupt, it will have plenty of room. This will often circumvent the need for orthodontic work in the future.